Foundation?
Yeah, sure thing. So when I was involved with the Young Health Program, I saw that they had identified the non-communicable diseases space as a gap. And I had also identified that as a gap within myself outside of the program, seeing that I was also born with a non-communicable disease. And I saw how even our parents were not even educated about these diseases, how they come about, how to prevent them, how to manage them.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases.
Okay, welcome to the African NCD Champion podcast. In this mini-series, we are featuring young people who are working with the Young Health Program in Kenya. And this program is implemented by the Plan International and is funded by the AstraZeneca. And without further ado, let's welcome our first guest today to introduce himself and tell us what he does. Welcome.
Thank you very much for welcoming me to this program. My name is Ogweno Stephen. I am an optimist. I'm a public health researcher. I'm a global health expert with interest in the non-communicable diseases space. I'm also a lived experience advocate, advocating for better policies when it comes to non-communicable diseases. I was a peer educator with the Young Health Program in 2016 when it actually started in Kibera. And I worked there with the program, and then I transitioned and started my own organization, courtesy of a lot of the learnings and a lot of the gaps that the Young Health Program was addressing back then in Kibera, which was around non-communicable diseases and young people. And so I started my own foundation where I'm the founder and the CEO of the Story Foundation. And globally, I sit in a couple of boards and committees, including at the World Health Organization, the Global NCD Alliance, and with the World Obesity Federation. So that's a quick introduction to myself and what I do in as far as this program is concerned.
Yeah, indeed, you wear many titles, and that is inspiring to young people, seeing what you've done in the Young Health Program, and almost a decade of you working in this space, and also getting the inspiration to start the Story Foundation. But could you take us through, how did you engage at the start with the Young Health Program? Just give us a walkthrough on how you engaged with the Young Health Program.
Yeah, so back then in 2016, I was already advocating in the non-communicable diseases space. And I remember my first interaction with the Young Health Program was off of a meeting that we had where different national NCD stakeholders were brought on board. And I presented what I do and what my passions were. And I met Danor, who was then working or leading the Young Health Program in Kibera. And we engaged. And after that, he was curious to see how we could be involved in the Young Health Program itself. And so I remember going into Kibera, we did the community survey, we did a mapping of the region, we came up with ideas and proposals for how the program could be implemented in a way that it could directly work with young people and also positively impact young people's activities. And after that, I have always been involved as a trainer of trainers, training a lot of the peer educators on the ground, training them on non-communicable diseases, training them on advocacy, on health communication, and also training them on how to present the different case studies that they get from the field. So I've been involved. So that is when I started, that is how I was involved in a lot of the initial setting scene for the program. And after that involvement, of course, I transitioned into starting my foundation, or the Sterling Foundation, which I think we'll be talking about as part of the next question. So.
Oh, well, thanks for sharing your initial experience when you started engaging with the Young Health Program. As a Young Health Program fellow myself, I must attest to how this program is very impactful. But I want to understand from your experience as a peer educator, how did this engagement with the Young Health Program shape your experiences and your next steps in life, including starting the Sterling Foundation?
Yeah, sure thing. So when I was involved with the Young Health Program, I saw that they had identified the non-communicable diseases space as a gap. And I had also identified that as a gap within myself outside of the program, seeing that I was also born with a non-communicable disease. And I saw how even our parents were not even educated about these diseases, how they come about, how to prevent them, how to manage them. And with the Young Health Program, during my days as an active peer educator, I saw that this is not only a problem that exists in Kibera, which is where the program first started, but I saw that this program actually was a much wider program, and we needed more actors to engage and to be involved in advocating for this work and amplifying the work on non-communicable diseases. And so when I joined Kenyatta University during my campus years, I decided to start the Sterling Foundation as a way to amplify the work and the learnings that I had had from the Young Health Program, and to get this message beyond Kibera. Because at the time, there were very, very few organizations that were working at the intersection of non-communicable diseases and young people. So when I started the Sterling Foundation in itself, my main goal was also to amplify this work beyond Kibera and also bring a lot more wider audience to learn about the non-communicable diseases, what they are, how to prevent them, how to treat them. And so a lot of the foundational lessons on what these diseases are, what should you say, how do you communicate them, I learned them from there. And then I implemented a lot of these learnings into the Sterling Foundation to amplify a lot of the work. And the Sterling Foundation, we then picked up a lot of the lessons and structures that we had learned from the Young Health Program and used them in our own programs to then amplify the work on non-communicable diseases. And this led us to implementing a couple of very impactful projects that were not only locally based, but had an impact continental-wide. One of our first serious projects was called Project Alpha, which focused on cancer and young people and educating communities on what cancer was. And this program really acted as a test bed to pilot how do you do health communication, how do you do proposals, how do you seek for funding, how do you seek for partnerships to implement the project. And the project ended up running for 3 years, a very successful project. And since then, at the Sterling Foundation, we've implemented 10 major projects that have been implemented in now 12 countries in sub-Saharan Africa. We've worked with over 75 health and wellness partners within these 10 countries, reaching over 10 million people. And this just goes to show you that with the Young Health Program setting a base, organizations individuals could come up with organizations that go on to really amplify the work and create continental level impact. A lot of our work, as you know, since you're also part of the Sterling Foundation, a lot of our work has received both local and global recognition, and we've earned a lot of local awards and recognitions, and also globally being recognized by organizations such as the World Health Organization, the United Nations Youth Office, the Global NCD Alliance, amongst other organizations that really amplify the work that we've done. And so it shows you that from these humble beginnings, the objective was amplified and we could even take it much further.
That's lovely. I mean, giving us a rundown of how the Young Health Program shaped your experiences, and the experiences that you got shaped your next steps. But there's one critical thing I want to ask you even before I go to how the learnings post the program accelerated your impact, because you part of the One Young World for 2019, and I suppose it was through this Young Health Program that you got the chance to go to attend the One Young World in London, and also visited the Queen. So could you just give us a bit of your experience during the One Young World Summit?
Yeah, so you also give your experience because you are also a Young Health Program fellow who also attended the One Young World through the Young Health Program scholarship via AstraZeneca in 2021. 2022. So I did. So during my experience in 2019, I was part of the individuals that were sponsored through the Young Health Program and AstraZeneca to attend One Young World, which is a global gathering of international leaders and delegates from all corners of the world, gathering to share insights, knowledge, and strategies to transform and amplify their work. During this period, I had the unique privilege of also visiting the AstraZeneca's offices in the UK and meeting the executive team back then, and even leading a session. I remember we did a demo session in the offices and bringing the flavor of what we do on ground to those offices and with the global executives so that they also see the impact of the work that they are supporting here on the continent. And One Young World really brought, as you know, a lot of connections and partnerships and networks that have been very useful in amplifying the work. And in fact, it's during this during this One Young World engagement that we got a lot of the partnerships that we ended up implementing the multi-award winning NCD 365 project. And this brings me to a question to you, since you are also part of the Young Health Program through the One Young World. So what was the experience like, and how does that tie back to this conversation on non-communicable diseases and young people?
Okay, well, I must admit that I didn't see this one coming. Because suddenly you're
the interviewer becomes the interviewee.
Yeah. So, my experience was also incredible. And, attending the One Young World Summit in Manchester. And one of the things that you didn't mention is that this is a gathering of more than 2,000 delegates. And it was wonderful. Just like you, we visited the AstraZeneca's offices in the UK, but that one is in Manchester. But also having a chance now to meet world leaders and people who, just peak impact. But it's also how your perspectives are shaped post the summit. I think for me, that is the highlight of all this, and seeing the wonderful projects that people are running out there. People who are just, like us, but just bold and confident and just want to create impact in the world. I think that emboldened me and the work that we do also at Storylink to just come back and see what one little thing can we do to impact the lives of others. And it was a nice one, and that is the time actually. One Young World ended prematurely because of the death of the Queen. So the London Bridge had fallen, and so we couldn't continue with the One Young World Summit. But it was the last day actually. So while it ended prematurely, it was a wonderful experience. Being able also to meet with this lady from Suits. What is it called? This Dutch of the Sussex or something. Yeah, but in Suits, she's called Rachel. And that was so wonderful. And I think that experience just inspired me even to do more and be able to impact the world. So, I mean, that is the highlight of my experience. But even post the program, it brought now other opportunities, and us applying even for the funding and implementing AstraZeneca funded projects. I think that is the highlight. I'm just going to go to the last question I wanted to ask you. For you, how did the learnings post the program accelerate your impact in project implementation? And also, you could talk about policy advocacy locally, regionally, and globally. You sit at the World Health Organization, you sit at the World Obesity, you're also part of the World Heart Federation. Could you talk about how this, the Young Health Program experience now shaped you and you accelerated your impact in this global engagement?
Yeah, sure thing. So I've continued to stay in touch with the Young Health Program even post my engagement as a peer educator. So I began from being trained, and then I became a trainer as a peer educator. And then I joined the board or the advisory board for the Young Health Program in Kenya to help support continuous work in the program. Off of the program and with the foundations that I learned from the program, I've been able to now be involved locally, regionally, and globally in a lot of health initiatives and programs that continue to improve access to literacy, diagnostics, and policy work in as far as non-communicable diseases is concerned. In Kenya, for example, where the Sterling Foundation is also based, we've implemented projects that have focused on cardiovascular health, including My Heart KE, Project Alpha that has focused on cancer, mental health matters that focused on mental health, the NCD 365 project, which is now a regional project implemented in 10 countries for 4 years that focused on improving literacy and access to diagnostics for non-communicable diseases. And we've also used innovation, including the use of mobile apps, social media, and technology to do a lot of our work. This local work has received local recognition, including winning the Quality Healthcare Kenyan Awards multiple times, being recognized by the Ministry of Health and Ministry of Youth, and a couple of other recognitions. Regionally, the NCD 365 project was one of our biggest projects from 2020 to 2024, which involved in its first year sharing text and poster messages on non-communicable diseases daily, coordinating 64 partners in its first year. In the second year, we did 55 animated videos that were shared weekly on non-communicable diseases, coordinating 78 partners in that project. In phase 3, we did start the podcast featuring lived experience on non-communicable diseases and including young people. And in phase 4, we did research and policy advocacy, where we produced 2 scientific papers based on our learnings from the project that have been published in high-impact international journals. So again, regionally, we've done a lot of work that, again, really stems from our initial learnings from the Young Health Program. And then when we look at the policy space, locally we've been advocating for policies to improve non-communicable diseases and address its risk factors. So for example, we are involved in the policies on trans fats regulation. We are involved in the policies on front of pack warning labels. We are involved in the tobacco and alcohol control policies in the country. And regionally, we've also been engaged in the policy space, especially with the World Health Assembly and the United Nations high-level meetings, where I continue to represent lived experience and voices from the global south, advocating for better policies when it comes to health, when it comes to universal health coverage and UHC. And so you can see that, again, what started at the Young Health Program has really amplified into global impact and global work in the global health space. And then also with my involvement with various organizations, including the World Health Organization, where I sit at the NCD labs and also at the Guidelines Development Group for GLP-1s, and with the Global NCD Alliance, where both of us were part of our view, our voices as NCD advocates, and then also being involved in the board, and even with the World Obesity Federation, where I sit as part of the board. So all of these opportunities, again, continue to really amplify the work that the Young Health Program started in addressing non-communicable diseases and sexual reproductive health amongst young people in the communities. And it has really shown that something that starts very small could amplify into bigger impacts locally and even globally.
That is wonderful. I mean, sharing the experience and how the Young Health Program has been, let's say, a launchpad for you and sending you out there even to the global platform. I suppose even as the Young Health Program Phase 2 comes to an end, it's leaving a trail of impact, looking at what it has done to the lives of people like Ogweno Stephen, starting their own organizations and now sitting in this global fora. It gives hope even to other young people who are looking forward to these opportunities and looking forward also to getting to such global forums. I suppose that brings us to the end, and thanks for sharing your wonderful experience, and we hope to see you on the next one.
All right, thank you very much.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.